still looking for work. So right now, I'm one of the 50,000 Lubbockites that doesn't have insurance. I looked at private insurance. It's going to cost me at least $400 a month. I can't afford that without a job. So my question to you is, why do you oppose a public option that would provide low-cost health care insurance for people who are in between jobs or for postgraduates?
Well, we already have in place some things for folks that are in between. In other words, we have for folks that are at certain income levels, they're eligible for Medicaid. We have community health clinics for people that can go in and you can pay based on your means and not based on.
If you have a list of those, I'd be glad to take
We
them.
will get you. They have a wonderful one here in Lubbock, Texas. And so the question is the reason I oppose the public option is this. Once the government gets into competing with the private companies, they don't have the motivation to keep providing the quality health care. They're only going to be concerned in the cost and being able to balance the books. And they're going to put all of the private companies out of business because the government uses funny accounting.
But the private companies don't cover me now as it is, so either way, it's
Well,
not good for me. I'm looking. If you're hiring, let me know.
They may not get a position. Got a deep concern about corruption in Washington. I think the main reason there's no fixes in the world or in the United States because of corruption. We have anything from felons that, felons being appointed to czars. We have a House bank that fell to overdrafts, to bounce checks. I got a whole list of the corruption in Washington. But the deal is, I want to see some care, and this is not just on the Democrat side. This is on the Republican side. How many recent tax evaders have we had? Not one of them been charged for tax evasion. Meanwhile, there's for the same thing. But when it happens in Washington, there's an unwritten rule. We're not going to charge each other with this, whereas we the people want to shoot you.
Absolutely. It's kind of the way I feel about what you just said about Congress. Congress ought to not live under the same standards that the American people do. That's the reason I co-sponsored or signed on a bill that says, if this in fact passes, I want the United States Congress and federal employees to be on the very same system. And you're exactly right. I mean, it is if we know that we've got a couple of members that didn't report income, and unfortunately, one of them happens to be the chairman of the committee that assesses taxes, and so that's a little ironic. And quite honestly, it's a distraction that the Congress doesn't need. We don't need that kind of activity going on because it causes the American people to lose confidence in their government, and so I'm as frustrated by that process as you are, and I'm hoping that the Justice Department and the IRS and all of those agencies, we have finally had a couple of members that did engage in activity. The gentleman from Louisiana the other day was finally convicted for. We had a couple of Republican members that went to prison, and so. But I'm with you. I think sometimes those wheels turn a little slower. Yes, sir.
Real quick, Randy, let me make a comment. If we had a $700,000 stimulus bill that was voted down, when it had a bunch of pork added into it, all of a sudden all the Republicans voted for it. That's corruption. Yeah. They were paid for the vote.
Just for the record, this Republican did vote for that stimulus package. Yes, sir.
Yes. This is my first time here.
Yeah, good.
But I'm also, I have trouble talking at times because I'm dyslexic and I'm on disability. My question is, on disability, why is it not everybody equal?
Well, every disability case is different.
Well, I'm getting told, since I worked 30 some odd years, my rights are not the same as everybody else is on disability.
Well, here's
And the thing is that I couldn't get with your program because I can't read and write well enough, because I read and write second grade level. And I'm getting ready to be 55 years old. And I live my life not knowing a lot of things every day. And I've been trying to get the state of Texas, Robert Duncan, John Cornyn, what is his name, to answer the phone and talk to me and answer my questions. Nobody wants to answer my questions.
Well, here's what's about to happen. One of my staff members is going to come over to you that works in my Lubbock office, and we're going to get your name. I make a practice in these town hall meetings not to talk about individuals' specific cases, but what I do want to do, and I'll promise you that I will do, I will sit down with you, and if you're entitled to some benefits, I will do everything I can to make sure that you get those benefits. And so.
I pay Medicare, but there's some people on disability that does not have to pay Medicare.
Yeah. Well, this is Mary Whistler, and we're going to do that because they're. And I'll tell you what, these programs are very complex, and sometimes, and that's what my staff does all the time. A lot of these agencies give our folks a runaround, and we're not always successful. But I will tell you this: that we work hard to make sure that. Those benefits that you're entitled to, that you're going to get, whether you're a veteran or you're disabled or you're a senior citizen or whatever it is, that's part of my job, is to make sure that you do that. And so, in contacting Mary, we will work on that. Thank you for your comments.
Thank you.
Sure.
Get your answers. So I have a question. I'm currently employed. I'm a student at South Plains, and you want me to get on private health care, correct? Well, here's the thing. I have a pre-existing condition that every private health insurance will not cover me because of it. Unless there is a government option that will not disqualify me because of the pre-existing condition, I will go throughout my entire life without ever being eligible for health insurance. What is the answer for me?
And I know a while ago when you heard me talking about the principles that I think that any healthcare plan that we come up for the American people. And one of those concepts is for people with pre-existing conditions, we need to provide avenues for them to be able to get covered. In Texas, we have a pool for that people that have pre-existing conditions that are eligible to be put in that pool. Now, what I hear about it, to be very honest, is that sometimes, yes, I can get into the pool, but it's very, very expensive. And so what I'm wondering is, instead of just banding that pool to people in Texas, if we had a bigger pool where we could put more people in that and bring the actuarial cost of that program down some, could we get you a better deal? But I hear you loud and clear, and so my opposition to the president's plan is, on that point, is not different. But I have a different way to do it, and rather than saying, well, the government's the only answer to that, I'm willing to say, let's be entrepreneurial. Let's look at some other ways to see if we can build a model where you can get health insurance, and I'm committed to do that.
Thank you. And now.
I'm sorry.
What do I do in the time between when what you're saying happens and right now?
Well, as I mentioned to you, is we have some clinics that are available. That some of those are nonprofit clinics that churches or other organizations fund. We can get you a list of those where you can go and get that. If you have other issues, you can. Mary Whistler and some of those folks, you may be entitled to some benefits. What we find is there are a lot of programs out there that were in place for folks, but people sometimes don't know about them, or they're embarrassed to go apply for them or whatever. But my office is always available to work with folks, and if there's a solution out there, we'll try to help you find it. But long term, from a policy standpoint, I think we do need to look at that area of that, and we're going to try to do that. Yes, sir.